Hi, I'm Dr. Fruth, family physician, and this is today's consultation. Today I'd like to talk about the IUD, the Intrauterine Device. You know, it's hard to believe, but 45% of all pregnancies are unplanned. That's 2.8 million pregnancies a year in the United States. Well, the IUD is an effective form of birth control for women as young as teenagers all the way to those who are approaching menopause, who are looking for 3, 5, and 10 years worth of contraception. There's basically two types of IUDs, the copper IUD, which lasts for 10 years, and the Skyla and the Leda IUDs, which last for 3, and the Marina IUD, which lasts for 5 years. The IUD is a very effective form of birth control. Most couples who don't use contraception, 85% would become pregnant in a year. Well, with the IUD, only 2 out of 1,000 would become pregnant with typical use of an IUD in a year. The IUD is very available. You can get an IUD with many family physicians, most gynecologists, and many Planned Parenthoods. When you go to inquire and get your IUD, your physician will first want to be sure that you're not pregnant. You'll be screened for infectious disease, and the physician may want to be sure that your pap smear is up to date. If you're over 21 and in your 20s, a pap smear is done every 3 years. And after the age of 30, a pap smear is done every 3 to 5 years. When you are in the exam room, you'll lay back in what is maybe known as the pap smear position. Physicians call that the dorsal lithotomy position. The physician will want to know the size, shape, and consistency of your uterus by doing a bimanual exam. That's done by placing 2 fingers into the vagina and then a hand over the uterus to feel the size of the uterus. Next, a speculum will be inserted into the vagina to visualize the cervix. Cervix is clean. And then the uterus is sounded with a device to see how long it is so we know how far to place the IUD. The IUD comes in a device that's about the width of an eraser head. It's inserted into the cervix and into the uterus, and during that process you might feel a little bit of cramping. The device is pulled back and then little wings come out of the IUD, and that's what keeps the IUD in the uterus. There's a string that will be cut, and you'll be able to feel for that IUD string to be sure that the IUD is in place. After the IUD is placed, most women are not even aware that it's there. Some people do say that they are aware of it, they have a little bit of cramping, but that eventually goes away. Periods tend to become lighter. It does not prevent ovulation. You continue to ovulate, and how the progesterone-emitting IUDs work is they create a very thick mucus plug so that sperm can't even enter the uterus, and a very inhospitable environment for the sperm if it were to get past that big mucus plug. Well, while the IUD is very effective in preventing pregnancy, it is not effective in preventing sexually transmitted infections. So if you are not in a monogamous relationship, you need to use condoms. Again, the IUD is very available, very effective form of birth control. So contact your physician, your Planned Parenthood, your gynecologist. Go down and talk contraception. This is Dr. Fruth, family physician. This was today's consultation. Remember, this video is for educational purposes. Please consult your healthcare professional for personal medical advice regarding your healthcare needs.